Talk Health, and I'm your host, Chinomsu Amadi. Today on the show, we bring you education on cervical cancer. First, let's go on a short break. Let's Talk Health continues shortly.
Hi, my name is Dr. Abie Kalaiwo. I'm the Executive Director of MedBridge International, and I want to encourage you to keep watching Let's Talk Health.
Now it's time to join Dr. Bello Abubakar, a consultant oncologist, to tell us what we need to know on cervical cancer. All right, sir. Thank you for joining us on the show today. Okay, Doctor, we'll start from you telling us what cervical cancer is.
Cancer of the cervix or cancer of the neck of the womb. Okay, so the female reproductive system has the womb, it has the tubes, it has the ovaries, it also have the neck of the womb. So when you develop a cancer around the neck of the womb, that is called cervical cancer.
Right, what are the risk factors that can predispose a woman to cervical cancer?
There are risk factors that when you have them, the likelihood of developing cancer of the cervix becomes higher. The number one risk factor is an infection with the human papilloma virus. It accounts for about 85% of all cervical cancers. So anybody that is infected with that virus has the tendency of developing cervical cancer. There are so many subtypes of the human papilloma virus. Now, we do know now that there are those subtypes that are really what is called the high risk human papilloma virus subtypes. So we are looking at 11 and 16, and of course we have others like 45, like 6, and so on and so forth. But the most important ones are the ones 11 and 16 that predispose to cancer of the cervix. That is one risk factor. The other risk factor is actually persistent trauma. So if you have a young woman who has had multiple pregnancies or multiple deliveries rather, because of the stretching, persistent stretching. So for grand multiparity, the chances of developing cancer of the cervix early is also established, and so on and so forth.
Now let's get to the symptoms. What are the symptoms that one is supposed to look out for when it comes to cervical cancer?
The human papilloma virus is sexually transmitted. Men are usually passive carriers. They don't develop any illness. So the virus is usually deposited into the female reproductive organ, and with time it affects the lining, the epithelial lining of the neck of the womb, and that undergoes several changes which will culminate into cervical cancer. So it's a process. It takes a long time for the process to develop. So that is why we say that cancer of the cervix is actually preventable, because if you do certain things, which I'm sure we'll discuss, it's possible that you can actually prevent it from happening. Okay, because it's not something that develops overnight, and there are processes that will happen before it develops into cancer of the cervix.
Now, after finding out all of these symptoms, what next? What's the next step that should be taken for a woman?
The first most important symptom that a woman will notice is bleeding, abnormal bleeding, especially contact bleeding. So anytime there is an intercourse and the woman goes to wash and she sees blood, she should be alarmed. It doesn't mean 100% that it is cancer, but it is one of the important signs. Okay, so contact bleeding is the number one sign that the patients will develop. Again, the patient may develop persistent, purulent vaginal discharge. Okay, so it's offensive, persistent. In spite of treatments, the symptoms still persist. Sometimes you see that discharge is mixed with blood, and also those are signs that will trigger or will tell the patient that she needs to have medical examination. Other symptoms are signs that show that the disease is actually advanced, such as pain. When the patient is having lower abdominal pain, persistent lower abdominal pain, and she's also having continuous bleeding, persistent bleeding, then she should be worried. There's so many, so depending on where exactly the location, because the cervix is something that is round, okay, so it can be located in the upper part or in the lower part or in the lateral part. So depending on where the disease is starting, you may actually tend to have symptoms. So if it is on the left side, for instance, you will have left pelvic pain, okay. Sometimes there is another symptom, a kind of fullness. The patient feels that like she's carrying something in the abdomen, in the pelvis especially. That may suggest that she may have that.
At what point is pap smear recommended? Does a woman
yes.
Yeah, after finding
So when a patient has any of the symptoms I've mentioned early, she should see a gynecologist who will do a vaginal examination. He will literally do a digital examination, and this will be followed by a speculum examination where he can actually visualize the cervix. Okay, during the digital examination, the doctor feels if it is a smooth surface or it is craggy or there is a dimple and so on and so forth. After that, he will do the speculum examination where he can actually visualize the cervix itself. If there are areas that are suspicious for disease, then he will go ahead and do a biopsy. Biopsy simply means take a chunk of that area, using a particular type of knife. He can just remove part of it, and that will be analyzed in the laboratory. So when that is established, that will confirm or otherwise if the patient actually has cancer of the cervix. There are those, however, that are picked on routine examination. So we encourage women from sexual debut to be having what is called pap smear.
I was going to ask that.
Yes.
At what age specifically?
So from sexual debut, because we said that it's a sexually transmitted disease.
Okay.
So if anyone has had contact with a man, chances are that she could have had a contact with the human papilloma virus, because men, like I said, are passive carriers. Hardly do they develop any disease, especially cancer of the penis, from the human papilloma virus. So from sexual debut, they are advised to have pap smear once every year. Once every year, okay? And that will detect not the disease, but even precancerous condition. So it detects precancerous condition before the cancer develops, okay? And that can be used to prevent the cancer itself. Because what it does is it will look at the kind of cells. I told you that the cancer develops through processes. There are, I don't want to bore you with the terminologies, of metaplasia, hyperplasia, and so on and so forth. So it is on this basis that, the pap smear will detect precancerous condition when it has not even established the disease process itself. Because the treatment is so different, when you have a precancerous condition as compared to a cancerous condition. So there are other methods, of course. It's not only pap smear. There is what is called, yes. Yes. So there are VIA, visual inspection with acetic acid, or visual inspection with legal iodine, and so on and so forth. Those ones are usually easier, they are cheaper to do, and can be done by any community worker, and so on. The only problem is that sometimes they are not properly trained, so they can miss some of the early cancers. So that is just the only risk. But pap smear, when you do this smear, you just like taking a swab around the cervix, put it on a slide, and then you send it to a pathologist, and the pathologist look at the cells and say, okay, these are normal cells or these are abnormal cells. So that is the process. So because you are sending it to a pathologist, chances of getting false results are really slimmer. So that's why pap smear is superior to most of the other things that we do.
How preventable is cervical cancer?
Well, you see, lifestyle changes are important because we do know that they are sexually transmitted. So the more sexual partners a woman has, the more likely for her to develop cancer of the cervix. So that is one. So sticking to your man is very crucial and important. Again, even the men must stick also to their women, isn't it? So that the disease is not spread around. So that's the most important lifestyle changing positive aspect that people really need to understand. As far as awareness is concerned, yes, there are a lot of NGOs that are going around, educating people and even offering free screening. I do know of an NGO called Egobeke Cancer Foundation. That NGO goes around the villages, especially around Abuja, to educate people and also offer free cervical screening. I know that they do have a center in Duthan Alhaji, that's along Buari side, and they offer. So there are many NGOs, but because of the type of society we live in, people are still don't want to go and expose their private part, to hospitals and so on. There are some people that don't understand the enormity of the disease and so on and so forth. So a lot of people in the rural areas are not even aware, But I want to believe that the awareness is improving significantly in the years than what it used to be. And we tend to have, with, improved awareness, you tend to have early diseases as compared to what we used to have a couple of years ago, that most of the diseases are actually end stage or late stages.
Now, what are those behavioral changes that are recommended for women? What are those things that, lifestyle changes, and one is meant to take note of to prevent cervical cancer?
Oh yes, because the disease only affects the neck of the womb. So when it is detected early, it doesn't have so much implication as far as bearing children is concerned. However, the treatment that is being offered may predispose the patient to so many risks. One of which is infertility secondary to radiation of the ovaries. Because the treatment modalities include radiation, chemotherapy, and even brachytherapy. So with all this, the radiation itself is such that it covers an area that involves the whole womb and even sometimes part of the ovaries. So if you expose the ovaries to that dose of radiation, chances are that the ovaries will be knocked out and they will not be producing eggs again. So patients that are quite young with a very early disease tend to have a procedure, or a surgical procedure rather, that will push the ovaries out of the field of radiation before commencement of radiation. That will guarantee their fertility. Okay, so fertility is something that is taken very seriously, but like I said, most of the people that develop the disease tend to have had, their family completed. So fertility is not something they are really worried about.
Now, how treatable is cervical cancer?
Okay, so there is a vaccine, or there are vaccines that are to prevent people from contacting the human papilloma virus. And they are usually given to very young age before sexual debut, between the age of 7, 9 up to 13. Okay, but now we found out that you can actually have it even in adults after they have done some tests to make sure that they are not exposed to the human papilloma virus. Yes. So it's advisable that you do the test before you take the vaccine, okay? So that you are not exposed actually. There are some blood tests that you can actually do to detect if you have the virulent virus, because the viruses are so many. There are about 145 subtypes, okay, but not all of them are virulent. Okay, so you need to find out the ones that are the ones that can predispose to cancer. That's what it means. So you really have to know that you are not exposed to those type of viruses. Then you can now do the vaccine. The vaccines are, like I said, many. There is the bivalent vaccine that is targeting only the two subtype of the virus that cause the human papilloma and that cause the cancer of the cervix.
All right, thank you very much, doctor. It was nice having you on the show today.